My name's Sarah Smith. I'm a consultant in public health here at West Yorkshire and Harrogate Health and Care Partnership, and I lead the Improving Population Health programme. So essentially around kind of how we can improve the health of the 2.7 million people who live in West Yorkshire and Harrogate, who are represented in the nice infographic behind me. I'm going to cover across two of the other recommendation themes. So one of those themes is population planning. So essentially how we ensure that we're planning services and delivering services in a way that meet the needs of our population. We heard quite strongly throughout the review that one of the things we need to understand the population and to really underpin what we're doing is we need ethnicity to be recorded in the right way across all settings, and we also need that data to be put in the hands of decision makers and coupled with insight and stories as well, so we can really make sure the services we're planning and designing meet the needs of our population. So that really makes up the first recommendation that we're talking about in relation to population planning. We had a great example from a voluntary community sector called the Feel Good Factor in Leeds, who are working with their primary care network and really coupling the data that they're getting and kind of sense checking it with local populations. So they're the kind of things we'd really like to build on in terms of the population planning element for the first recommendation, in addition to making sure we're actually recording ethnicity in the first place. The second recommendation was around making sure we've got community representation throughout the whole planning process. So when we're thinking about understanding needs in the first place and people around the table, when we're designing and procuring services, we've got that real representation that's reflective of our local populations. And the same when we're kind of delivering care and evaluating care, that representation is there too, right through to when we're looking at how we improve services. So that makes up our second recommendation. Our third recommendation, we heard a lot throughout the review process, both from local communities and from the voluntary community sector themselves, around how people were being supported during the pandemic through these organisations and the really important role that they were playing. So we made a recommendation to do more to support the voluntary and community sector in delivering these services and making sure commissioning arrangements could really allow them to be on a level playing field with other providers in the design and the delivery of care. So that makes up our third recommendation for population planning. We then had a recommendation around service access, so how people are actually entering services and accessing services, and are they really representative of the local population in the way that they need to be. So we've made a recommendation to monitor that and to really understand that, and part of that will be working with our organisations across health and care services to help them understand inequalities and help them to address them as well. And also to really understand who's not accessing our services that could be, and making sure we're not missing people. So, for example, population groups that aren't represented or registered with general practice, how are we supporting those groups, and who are we really missing? So that makes up our fourth recommendation. And our fifth recommendation, again, will be really reliant on engagement. And it's about making sure the services, we call it a culturally competent, again, meet the kind of cultural, religious and social needs of all the populations we serve. So that might be making sure we've got a representative workforce. So when people enter services, they can relate to the people they're seeing. And also making sure services are accessible in terms of digital pathways and in terms of the information we share with people to make sure they're acceptable to the population that we serve. And that will mean that we get the right people through the services and make sure they kind of engage in the right way as well. So they're the kind of 5 recommendations around population planning. If we could have the next slide, please, Jo. So our final area that we looked at for our kind of deep dive for our themes for the review was around reducing inequalities in mental health by ethnicity. So the reason we decided to look at this element was we heard a lot throughout the pandemic around the disproportionate impact on people's mental health and well-being for specific ethnic groups. We heard stories from feedback we got from Healthwatch Leeds and from a specific piece of work that happened in Calderdale working with BAME communities. We got a lot of feedback really when they're asked questions around kind of how COVID had impacted on them. The health needs came out, but what came out more strongly was the impact on mental health, or what we would call the determinants of health, and the impact on people's well-being. So that was things related to job security, access to food, financial concerns, and concerns with kind of housing and health as well. So things like overcrowding. So our first mental health recommendation was really around the work we need to do to really consider the disproportionate impact on what we call those determinants of health. And there'll be a focus there looking at health and housing conditions, and also employment as well, and skills and opportunities for different ethnic groups. So that'll be a real focus, and that's the first of the mental health recommendations, with the acknowledgement that all those things impact on people's mental well-being as a kind of a first step to good mental health. Then the second element was around, actually there's a lot going on already in relation to really good practice for improved mental health and reducing health inequalities and mental wellbeing. So all the great work of local authority public health teams, voluntary and community sector, there's loads of examples of good practice out there. So our second recommendation is we do a piece of work to coordinate that work, to share the good practice and learn from it, and to improve the use of the data and insight that we already hold, and to also to use that to coordinate some training. So if we're really starting to understand what barriers people have to accessing mental health and care services, how can we use that to coordinate training on that to frontline practitioners and the people designing and delivering services across West Yorkshire and Harrogate. So that made up our second recommendation, sorry. And the final recommendation, again, speaks back to the voluntary and community sector and the stories we heard around specifically during the pandemic, but actually it's an ongoing issue of if people aren't able to access mental health services or primary care services to talk about their mental health needs initially, often the first port of call is our local community sector organisations who are really embedded within local areas, and we'd like to do more to support those organisations in supporting people with their mental health needs, so helping them get into services, but also just that kind of support with mental well-being that might mean they don't need to access health and care services eventually, because we can support them in the first place in the community. But in order to do that, we recognise we need to be supporting the voluntary community sector, both with their own personal resilience to handle hearing these stories and to support people themselves in the community, but also support them with some practical skills and specialist mental health input. So that's what made up our third recommendation for the mental health outcomes. Have the next slide, please, Jo. And this is a summary of the recommendations. I've gone through them all, but if you want to look at them in more detail, they're in the report and demonstrated in this infographic. So next slide, please, Jo. And the next one. Perfect. So the next steps, we've kind of summarised some high-level recommendations. So we've said what we're going to focus on, out of all the things that out of all the kind of evidence and insight we brought together. The next steps will be, well, how are we going to deliver that? Who's going to do it, and by when? So the next steps will be developing an action plan. It will be a measurable action plan with people or teams aligned to delivery of the recommendations, and that will be available around December time. We're going to take it to our partnership board and present it there. So the next steps really is we really look forward to sharing that action plan with you, and showing you actually from these recommendations how are we going to deliver and what that's going to look like in practice. So that's everything from me. Thank you very much.